everyone. So we are the Physicians for Human Rights student group here at Northwestern, and I and my fellow exec board are really excited to introduce you to our organization and all we do.
My name's Jay, and I am the co-director for the organization Physicians for Human Rights. I'm a rising third year in Weinberg, and I'm on the pre-medical track, and I have hopes of becoming a physician who's able to provide care to vulnerable and marginalized populations.
So I am Isra Maududi. I'm the other co-director of NUPHR. I am also a rising third year in Weinberg. I'm studying cell biology and physiology with a myriad of other interests like public health, global health, sociology, all the fun people-centered things. I am also pre-med, and part of the reason that NUPHR is really valuable to me is because it really helps me explore those other interests and delve within all the other issues that affects one's health aside from just physiology itself.
Hi, everyone. I'm Sam Keimweiss. I'm your Director of Community Engagement at PHR. I'm a second year. I'm studying philosophy and global health. And I'm very interested in health disparities, especially cancer disparities. It's one of the reasons I'm a public health, pre-public health track, not pre-med. I've been exploring these things through PHR in addition to other organizations like the American Cancer Society, American Public Health Association, and Memorial Sloan Kettering Cancer Center.
Hey everyone, I'm Alex. I'm the treasurer. I'm a rising fourth year, majoring in biology and global health. I'm also pre-med with the goal of becoming a physician. Thanks.
All right, so the PHR National Chapter. So PHR is an organization that is spread across the US that's committed to helping protect human rights for the most vulnerable populations. And they do this by utilizing the tools provided by the fields of medicine, science, and law. Now, our membership consists of people on pretty much every tier. Medical and legal professionals are a part of the national organization, as well as medical and undergraduate students. And some health-related issues that the national chapter addresses are asylum and persecution, sexual violence, torture, and others.
So the Northwestern University undergraduate chapter was founded in 2019, making it the second ever chapter of the undergraduate program. It was created with the goal of giving students the opportunity to engage with the wider PHR network, allowing them to advocate for health-based human rights abuses through various projects and events, while also allowing them to develop the skills needed to be effective leaders in the health and human rights sectors.
Over the last year with the pandemic, Northwestern's chapter of NUPHR has been holding a number of activities to continue our interest in public health and human rights. One of those the largest ones of those was the roundtable discussions we held weekly virtually over Zoom, which discussed contemporary human rights issues of particular interest to members. We also had a health equity project, which was in two parts. One was a media campaign that spread information about human rights abuses within the IDOC. And the other was a policy brief that we wrote in support of an ombudsman office to help prisoners who've been affected by those human rights abuses appeal their case and find resolutions. In addition, we also had a medical Spanish course that included an introduction to physician-patient interaction, interpreting medical histories in Spanish, and doing all of that while exploring healthcare concepts unique to Spanish culture and getting a unique non-English lens on public health in America.
So for membership this year, we are very excited to get back into the swing of in-person activities should circumstances allow for them. But regardless, we intend for this year to be full of goals and service towards our community. And that's kind of the people we're looking for to be part of our organization. We intend to be a space for those interested in health and using that interest to A, expand their knowledge regarding various issues, and B, ultimately do meaningful work to interact with those issues and work towards change. Now, we understand that schedules vary and some people are busier than others, so we don't want to make that a barrier for involvement at all. As such, we've had the option of only being a general member in which individuals can participate once a week during general meetings and are free to sign up for activities outside of general meeting times as is convenient for them. For those who may be particularly interested in certain projects and have more time to be able to commit to them, they have the option of joining that project team in which they would have other responsibilities outside the general meeting pertaining to their specific project. So it would involve planning and execution of the project, whichever form that may take. So then to give a bit more information on general meetings, as we were a bit vague in the previous slide, they're weekly meetings that take a myriad of forms, the plan for that week being emailed out prior. One thing we have done in the past that Sam discussed was roundtable discussions, which are basically just an informal discussion for a designated topic. It's meant to be both a learning space and a sharing space, so it's not a lecture hall sort of thing by any means. It's basically somewhere where we can all get together with snacks and share our thoughts regarding a health issue. Oftentimes there will be an article pertaining to that health issue to kind of build off of, just to kind of serve as a starting point, but no one's going to pressure you into speaking, but every voice has a right to be heard and every voice has a right to be respected. So we encourage you to share any thoughts you have so long as you're comfortable. Those will most likely be every other week. And then with the other weeks being taken up by volunteer events, any guest speakers we may be hosting, I'll also take this time to let you know that you are free to approach us with an idea for a roundtable discussion or a general meeting activity. We would absolutely love that. We're passionate about learning from everyone in our organization. It's a very much community kind of thing.
So our first project will be regarding immigrant health equity. And our goal will be to uplift the voices and concerns of the immigrant and undocumented communities on our campus and beyond. So as a broad overview, we will be launching a digital advocacy campaign to educate and spread awareness for issues like coverage inequities, the pandemic, and language barriers. And this will be achieved through our social media accounts, speaker series, various educational workshops, and other mediums. And alongside this campaign, we will also be volunteering with other Chicagoland organizations to provide hands-on aid to this community.
So a particular interest of mine is women's health broadly, and this year the project I have kind of focused our efforts on is menstrual hygiene management. Unfortunately, period poverty is a really big issue worldwide, the US being no exception. So what we really want to do is to get people the products they need while also learning about the issue. So while really a lot of what we will be doing is hosting drives for menstruation products, I also hope we can get some advocacy and dialogue going surrounding things like period poverty, the stigma surrounding having a period, education regarding periods, pregnancy, etc.
I've mentioned in my introduction that I'm very interested in cancer disparities, and I'm planning on bringing that into PHR in an upcoming project. Thousands of disproportionately poor and disadvantaged and non-white Americans every year die from cancers that could be prevented from early screenings. And the pandemic has made that much worse simply due to the fact that people haven't been going to routine appointments where they would be getting their colonoscopies or their mammograms, or be given information as to where they can get screened. So we on our Northwestern level can look and try to improve those numbers in our community. First, by educating ourselves, by learning ourselves about what types of screenings are being neglected and getting ourselves screened. And then by partnering with community organizations that are already operating in Evanston in this field to try to restart the screening drives from before the pandemic and get accessible screening to the Evanston and Chicagoland community. Finally, hopefully we can advocate as well to lawmakers on the both local and national level to support increased funding for those screening programs that are helping people across the nation get access and early detection for cancers.
So a very pressing but highly neglected issue in the US is the lack of access to sufficient nutrition. You'd expect that a country as advanced and developed as the US that food insecurity would have been a thing of the past. However, in Illinois alone, it's estimated that 1 every 7 individuals will experience food insecurity at some point this year. That's why I thought a really worthwhile project for PHR this year would be to try to help address this issue in some way. In particular, I wanted to collaborate with local restaurants in the Evanston area in order to raise money for the Evanston Foods Insecurity Initiative. The way these kinds of fundraisers have worked in the past is that a portion of any purchases made during a certain period of time will be given to us, so that can be donated to the organization of our choosing. I'm expecting to be able to run this kind of fundraiser at least once per quarter, so it'll be ongoing throughout the year.
Thank you guys for watching. Please look out for us at the organization fair. We will be there with our trifold. And in the meantime, please send us any questions you may have. These are our emails, and that is our NUPHR email. Thank you so much.